Welcome to Udaya Explain, the podcast where we break down the complex science behind today's health concerns. I'm Dr. Imeshika Komudu, and today we're diving deep into the molecular mechanisms and physiological pathways of vaping toxicity. Joining me is Dr. Udaya Wimalasiri, a research scientist from Faculty of Medicine, University of Kelaniya, who's been researching the biochemical impact of electronic cigarette aerosols. Dr. Udaya, thank you for being here.
Thank you for having me, Dr. Imeshika. This is a critical topic that requires urgent scientific discourse.
Let's start with the fundamentals. When someone takes a puff from an e-cigarette, what exactly is happening at the molecular level in that aerosol generation process?
That's an excellent starting point. The aerosol formation occurs through pyrolysis when the heating coil reaches temperatures between 100 and 250 degrees Celsius. What many people don't realize is that this process creates nearly 2,000 distinct chemical compounds, the vast majority of which remain unidentified. The primary constituents include propylene glycol at approximately 57 grams per 100 grams, glycerol at 37 grams per 100 grams, and ethylene glycol at 10 grams per 100 grams.
And that's just the baseline composition. What happens when these compounds undergo thermal decomposition?
This is where the toxicology becomes particularly concerning. The thermal degradation generates reactive carbonyl compounds, specifically formaldehyde, acetaldehyde, acrolein, and glyoxyl. Recent studies show formaldehyde retention in the respiratory tract reaches 99.7%, with a mean retention efficiency, while acetaldehyde shows 91.6% retention. The International Agency for Research on Cancer classifies formaldehyde as a Group 1 human carcinogen, and acetaldehyde as Group 2b, possibly carcinogenic.
Let's trace this journey through the respiratory system. What's the pharmacokinetic pathway from inhalation to systemic absorption?
The deposition pattern is critical to understanding toxicity. Ultrafine particles smaller than 0.1 microns, which comprise a significant portion of vaping aerosols, deposit primarily through Brownian diffusion. Particles below 10 nanometers are effectively removed in the tracheobronchial region, while larger ultrafine particles penetrate into the alveolar space. The surface area available for absorption in the lungs is approximately 70 square meters, facilitating rapid systemic uptake.
And what about nicotine specifically? How does its pharmacokinetics differ in vaping versus traditional smoking?
Nicotine absorption follows first-order kinetics with a total clearance averaging 1,200 milliliters per minute. The drug exhibits a steady-state volume of distribution of 2.6 liters per kilogram with less than 5% plasma protein binding. What's particularly important is that approximately 70% of hepatic blood flow is involved in nicotine extraction, indicating extensive first-pass metabolism through cytochrome P450 2A6 and 2B6 enzymatic pathways.
Now, let's discuss the heavy metal contamination that's been documented. This seems to be a unique toxicological concern with vaping.
Absolutely. The metal contamination occurs through direct contact between the e-liquid and heating elements composed of nichrome wire and other metal alloys. Recent analyses show disposable e-cigarettes release chromium, nickel, antimony, lead, zinc, and copper into the aerosol. Particularly alarming is that one disposable device released more lead during daily use than nearly 20 packs of traditional cigarettes. The bioaccumulation potential is significant. Studies show elevated urinary levels of lead, cadmium, antimony, and barium in e-cigarette users.
Let's talk about the respiratory pathophysiology. What specific mechanisms cause the bronchial damage we're seeing?
The pathophysiology involves multiple mechanisms. First, we have direct cytotoxic effects from aldehydes, causing epithelial cell damage and increased permeability of the alveolar capillary barrier. Second, there's oxidative stress mediated by reactive oxygen species generation, leading to lipid peroxidation and protein carbonylation. The most severe manifestation is bronchiolitis obliterans, or popcorn lung, caused by diacetyl exposure. This involves fibroblast proliferation and collagen deposition in the small airways, creating irreversible scarring with constrictive airflow limitation.
The data on pregnancy outcomes is particularly concerning. Can you explain the teratogenic mechanisms?
The teratogenic effects operate through multiple pathways. Nicotine readily crosses the placental barrier and accumulates in fetal tissues at concentrations 15% higher than maternal plasma levels. The critical concern is interference with cellular differentiation during organogenesis. Heavy metals like lead, cadmium, and nickel disrupt DNA replication and transcription factors essential for proper fetal development. Recent meta-analyses show 53% higher odds of adverse maternal outcomes and 53% higher odds of adverse neonatal outcomes, including intrauterine growth restriction, preterm birth, and low birth weight.
What about secondhand exposure? The aerosol doesn't just disappear.
Environmental contamination is a significant concern. The exhaled aerosol contains ultrafine particles that remain suspended for extended periods, creating ambient exposure to nicotine, volatile organic compounds including benzene, and heavy metals like lead and nickel. Studies demonstrate that secondhand exposure increases respiratory symptoms, particularly bronchitis and dyspnea, even in non-users. The particle size distribution allows a deep lung penetration in bystanders, with similar deposition patterns to primary users.
Let's return to the clinical implications. What biomarkers should clinicians be monitoring in patients who vape?
Comprehensive biomarker assessment should include urinary cotinine and 3-hydroxycotinine to assess nicotine exposure and metabolism. For heavy metal toxicity, we monitor urinary lead, cadmium, chromium, and nickel levels. Pulmonary function testing should focus on small airway obstruction markers, specifically the FEV1 to FVC ratio, and forced expiratory flow at 25 to 75% of vital capacity. Inflammatory biomarkers, including C-reactive protein and interleukin-6, can indicate systemic inflammation from chronic exposure.
What's the current state of regulatory oversight regarding these toxicological concerns?
The regulatory landscape is evolving but insufficient. Current FDA oversight focuses primarily on nicotine content and basic labeling requirements, but doesn't adequately address the complex mixture toxicology or long-term health effects. The lack of standardized testing protocols for carbonyl compounds, heavy metals, and ultrafine particle characterization creates significant gaps in risk assessment. We need comprehensive pre-market toxicological evaluation similar to pharmaceutical development.
As we wrap up, what's your key message for both healthcare providers and the public?
The toxicological evidence is unequivocal. Vaping involves exposure to a complex mixture of harmful chemicals, including carcinogenic aldehydes, toxic heavy metals, and inflammatory ultrafine particles. The respiratory pathophysiology demonstrates progressive damage through multiple mechanisms, from acute inflammation to irreversible scarring. For pregnant women, the teratogenic risks affect both maternal and fetal health through well-established biochemical pathways. The scientific community must continue rigorous research while effectively communicating these findings to combat widespread misinformation.
Dr. Udaya, thank you for this comprehensive analysis. For our listeners, remember that science-based health information saves lives, but only if it reaches the people who need it. Share this episode, engage with evidence-based content, and help us fight the algorithm with facts.
Thank you, Dr. Imeshika. The toxicological evidence speaks for itself. We must prioritize public health over industry interests and ensure this scientific evidence reaches as many people as possible through strategic digital engagement.
That's Udaya Explained for today. Until next time, keep questioning, keep learning, and keep sharing the science that matters. Don't forget to subscribe, rate, and share this episode to help our evidence-based content reach more listeners in the ongoing battle against health misinformation.